Oops. So why is that an emerging interest in the need to demonstrate a suitable health legacy from mass gatherings investments? Because every mass gathering, a large mass gathering, involves a lot of resources, and usually these resources are public resources. So countries now they have to have this commitment to demonstrate how this public investment is going to benefit the population that lives in the country. So this is why public health legacy for future host cities and countries are now important part of planning for these events. They have been documented successfully in Beijing and London Olympic Games, and we have had this experience in Brazil for the 2014, World Cup. So what is it? What is a mass gathering? It's considered a gathering of persons, usually of more than a specified number of persons, and it may vary from 1,000 to 25,000 persons at a specific location and for a specific purpose. It could be a social function, a large public event, or a sports competition, as we're going to talk about today. And legacy, what is considered a legacy? It's been considered the material and non-material effects produced directly or indirectly by these sporting events, planned or not, and they should change in a permanent way the region that hosts this mass gathering in an objective, subjective, positive, or negative way. This week we were preparing this presentation, and me and my students were discussing what we were studying about legacy, and there is a lot of material documents criticizing this legacy about and talking about this negative legacy in Brazil. So why did we start working with legacy? So for the World Cup 2014, the Ministry of Sports in Brazil, they asked every host city to develop a project on legacy planning for their specific site. It was promoted then by this Ministry of Sports, and it was funded by our National Council for Research. Here in Porto Alegre, the city where I live, it was coordinated by the University of Rio Grande do Sul. So what were the challenges for Brazil for the World Cup? 1 million foreign tourists from 202 countries were expected in Brazil. We had 12 host cities. So this is a lot of host sites. And the experience we've had before with mass gathering were specific for Rio de Janeiro, where we've had Carnival, New Year celebration every year, and we've had the Pan American Games in 2007. So our project was organized in these areas: airports, arenas, energy, urban mobility, health, security, telecommunications, and tourism. The aim of the project was to describe the process adopted to identify, classify, and evaluate legacy of healthcare planning in the whole city of Porto Alegre for the World Football Cup. Sorry, the aim of our project, the health project, the whole project, the aim of it was to identify legacy for all of these areas. First, first we were expected to follow the services, the actions, and the constructions that were being developed for the World Cup. And so for this, we used a classification that has been used in other mass gathering events with the colors yellow, green, and red to inform government and other stakeholders on how these actions, services, and constructions were being, how well these actions were being developed. So, meaning that green, they had a good schedule, they had a good content and quality. So they were updated with the schedule determined. And yellow, it was some problem. It should have some problem on any of these components. And red would have really severe problems to be solved. But then it turned out for the universities to be very difficult to evaluate these actions. So the project was directed for legacy. And then we worked with this development of legacy. First, how did we do this identification of legacy? First, we did a bibliographic research in the area of sports event legacy, and then from that we developed a standardization of legacy concept, and then we ended up identifying this legacy in health, health services and health services. And then after that, we did this classification of this identified legacy. These were the legacy we identified for the World Cup. And for this presentation today, we did an exercise. We used the legacy we identified for the World Cup and searched in the literature, documents, and news from the Olympic Games to see how this legacy were developed in Rio de Janeiro for the Olympic Games 2016. So the classification adopted were this one. From with dimension, we classified in what dimension, if it was sports or social cultural. So some of these dimensions didn't apply for health. The typology as well. We had this typology. I'm going to show next the typology dimension, how we classified. We classified if the legacy was planned before the mass gathering. It means that something that was already planned by our local or state or national government, and but it wasn't developed before, and then this mass gathering was an opportunity to develop this legacy. Or some were identified along the process. It means that when the mass gathering was prepared, this need appeared. We are classified as tangible or intangible. Tangible means that we can identify the legacy without any means of measuring. And intangible, we would have to have some instrument, some research, something to measure the legacy. In territory coverage, we classified as local, state, or national. And we also classified as situation before and after the World Cup, the possible impacts, positive or negative, the actions that could be taken as to mitigate or potentialize these impacts, some indicators for evaluations, and the type of indicators. Today I'm going to present until the 5th classification, territory coverage, on the next slides. So for the legacy, surveillance information system, computerized and monitored in real time. So it was considered an infrastructure legacy. It was tangible because we could identify, local because it was just for the city of Porto Alegre. It was planned before the World Cup, and it was classified as public policy and citizenship rights. What happened for the World Cup? In the city of Porto Alegre, we had improved notification system with reduction of time for activation of control actions. And for the Olympic Games, what did we identify? This intensification of actions to combat the mosquito for Aedes aegypti, because it was when we were having this Zika introduction in our population. For the certificate of food services, we can see on the right left hand side on the top the classification. For the World Cup, it was local, but Brazilian government developed for the World Cup national guidelines for to categorize food services. And it was applied as a pilot project to typical food restaurants in Porto Alegre. For the Olympic Games, these national guidelines were already tested, and they could be used for food services. And also we heard that food examination was developed in the harbor of Rio de Janeiro. What happened with health promotion initiatives? In Porto Alegre, educational flyers were developed in 3 languages. This is not what happened before we had the World Cup. We had information only in 2 languages. But Rio de Janeiro has a lot of experience with international mass gathering events. So they developed a traveler health portal was developed by the Ministry of Health to inform tourists before and during the games. So they had a national support for this legacy. A public health emergency plan for the airport was developed in Porto Alegre. As I told you before, Porto Alegre hasn't had a large experience with mass gatherings of this magnitude. So a contingency plan in public health was developed for our airport, integrating protocols from various sectors, which already existed in Rio de Janeiro. A notification system 24 hours connected to prepared professionals was organized with a structure of integrated operational centers responsible for the identification of emergencies in public health and immediate response. In Rio de Janeiro, this structure was activated and was responsible for the identification of emergencies in public health and immediate response. In Rio de Janeiro as well, there was a development of an APP called Health Wardens, which was very well recognized internationally as a tool for health surveillance in mass gatherings. In Rio Grande do Sul, the creation of a state force, it means a whole structure for health, with health professionals, logistic and human resources structures, was organized in the state for emergency situations, and it was supposed to last longer than the World Cup 2014. In Rio de Janeiro, professional councils were responsible for the registration of health professionals to take part of medical teams. It's interesting to see this difference on initiatives on a specific legacy, and from now of what we have analyzed from this situation of organizing this webinar, it seems to us that it would be very interesting to compare these experiences, different experiences that were developed in different cities or places, to see, to evaluate which one, what are the benefits and the barriers of any of these. Simulation exercises and tested protocols were also developed in Porto Alegre. It was as well we used to have this simulation and these protocols tested, but for the World Cup there was a big investment for that. In Rio de Janeiro, requirements were integrated to the existing procedures for emergency and disaster situation to direct professional training and the simulations. For the organization of treatment places to meet the surge demand, in Porto Alegre, an assistance plan for mass gatherings and a structure of advanced medical service was developed. In Rio de Janeiro, specific medical service in every site, including hospitals for the Olympic family, a polyclinic inside the Olympic Village, and medical teams and a temporary set of services with the support of medic teams were also organized. For the legacy of permanent equipment and medical care provisions in Porto Alegre, pre-hospital public air transportation service became available to our population with the improvement of emergency services infrastructure. In Rio de Janeiro, 140 ambulances and equipment were available for the Olympic Games, and these ambulances, this legacy for them was a national legacy, because after the Olympic Games, these ambulances were distributed all over the country. Also, it's important to articulate different components of the healthcare system. And in Porto Alegre, we have had the opportunity to follow this experience. And for most of services, health services in Porto Alegre, it was a first experience of integration concerning a mass gathering event. So this integration allowed this definition of responsibility for assistance in mass gatherings. In Rio, better integration between the components of health system services was possible, with definitions of responsibility for assistance in mass gathering events, since they've had much more experience with these large mass gatherings than Porto Alegre. An emergency plan was developed in Porto Alegre, and describing health services directions, where to find health services, their level of complexity, how to access, available equipment and medication. And the plan of action in Rio, a plan of action was developed for each installation in case of critical incidents. These plans were integrated to the state and local plans. So at each of their installations, there was a different plan of action. This is also a legacy which was developed in a different way from the Olympic Games to the World Cup. There was also partnerships for capacity building, and in Porto Alegre there was a partnership with private ambulances, and in Rio the partnerships was between private and public hospitals. Also, when we have a mass gathering, it's important to develop some organization, management for and regulation of hospital beds. In the state in Porto Alegre and the state of Rio Grande do Sul, an increased number of hospital beds was planned, but we know that we haven't gotten as many as it's been planned at first. But this was part of our organization. In Rio de Janeiro, 18 hospitals obtained international accreditation certificates, including the National Institute of Traumatology and Orthopedics, with increase of 300 beds. And also in Porto Alegre, there was the training of lay people in first aids. and in Rio, students were trained in first aids. So this was also different from Porto Alegre to Rio de Janeiro, because in Porto Alegre, lay people were trained to recognize heart attack and trained in first aids. And in Rio de Janeiro, medical and nursing students were trained in first aids, and they were supposed to help during the development of the Olympic Games. In Porto Alegre, students were not allowed to help during the World Cup. And we found some Olympics legacy other than the ones we found for the World Cup, and these were the creation of a national anti-doping agency in Rio de Janeiro, and some measures on animal health for the horses that were coming to Brazil for the equine part. So in Rio de Janeiro, this laboratory, it was a university laboratory, was accredited by the World Anti-Doping Agency and received investments on improvements and enlargement. So as a conclusion, the World Cup and the Olympic Games were opportunities for the Brazilian government to develop the specific policies regarding mass gatherings. This development allowed the government to assess and evaluate the resources to provide crucial support and build capacity for future events. We believe the classification developed for the World Cup proved to be useful when other mass gatherings legacy should be identified and could become good indicators for legacy development if necessary. These are some of the references. This presentation will be available for all of you, and thank you very much. So I'm available if you have any questions.
For those in the remote audience, if you would like to ask a question, you can use the raise hand feature, and then we can unmute your microphone and you can ask Professor Witt the question. We still have some time here, so feel free to ask questions. We may have a shy audience today. Well, if we don't have any questions, I suppose we could conclude the webinar then. Did you have any final comments you wanted to make, Professor Witt?
Well, either they understood everything or they didn't understand a thing when they don't ask any questions. But I'd like to thank you very much for this opportunity. And at the same time as we've had the opportunity to present our experience, it's important. It was important for us to make this a reflection on how this legacy development has been studied in Brazil. Thank you very much.
Well, I think we may have stimulated some questions here, because now I see a few. Do you mind sticking around for a few more minutes, Professor Witt?
Sure.
Okay, so the first person I see here is Alexandria. I'm going to go ahead and unmute your microphone if you'd like to go ahead and ask your question. Alexandria, over there.
Hi, yes. Good morning, everyone. And Professor Witt, thank you so much for this presentation on legacy. I think that it's fascinating. My question is regarding your surveillance for vector-borne diseases. It doesn't have to be Zika, but I'm curious how, can you talk a little bit more about your surveillance system and how you're still using it? Thank you.
Yeah. Thank you very much, Alexandria. If I understood your question, you would like to know how our surveillance system works for. I'll talk to you about how it works for the mosquitoes or for the vectors. And in Brazil, we have this community health agents, which are professionals who work for our health system. And we have a specific surveillance health agents in Brazil. So these surveillance health agents, they are responsible for the surveillance of mosquitoes. They visit the houses. They look for places where the mosquito is being raised or is growing. I wonder how to say, but they look for places. They treat these places, and so this is an initiative of our government to combat the mosquitoes. I wonder if I answered your question.
Yes, thank you. You did. I appreciate that.
Thank you.
Okay, we have a few more questions here, and actually I can answer them that were sent in through the question panel. There will be a recording of this that will be uploaded later today or early tomorrow to the WADM website and the WADM YouTube channel. So I'll send an email out to the participants when that's available. We had one comment from Jennifer, said, "Thank you. That was a very interesting presentation." Smiley face. and then we do have a request for a link for future correspondence. So if Professor Witt would like to share her email address, I could also include that in the email that informs people about the webinar being available online.
Yes.
And aside from that, I think we've answered all the questions.
Okay.
Thank everyone for their participation this morning or afternoon or evening, depending where you are in the world. And I will send an email out letting everyone know how they can access the recording. And if would you be willing to share the presentation, a PDF of the slides? Because we could also post that to the website.
Okay.
Thank you so much. We appreciate you taking the time to do this webinar for WADM, and we hope everyone has a good evening or a good day or a good night, wherever they may be.
Okay, thank you very much.